Definitely yes, definitely yes. In fact, there's a lot of research which has been done, which shows that when we look at disorders like, say, depression, anxiety, more of the neurosis conditions, um, substance use, definitely there is a difference where women are at a greater risk. In fact, some research shows that I could just read out a couple of statistics. This was a research done by Savita Malhotra and her colleague in 2015. It's a published research in the Indian Journal of Psychology. When we look at anxiety, depression, and in general psychological distress, women are 2 to 3 times more likely to experience these conditions compared to men. Somewhere men seem to have uh, see, if I were to ask you, or if I were to ask us to look at what is that main thing which differentiates a woman's experience in our society as it is, I'm not talking only about urban, I'm talking about in general. Keep India as an entire country in your mind, not just Mumbai city or Bangalore or Delhi, where it's a prime kind of cosmopolitan environment and all with education. If you look at overall India, men definitely seem to have a higher, more superior, platform that they are in. They seem to have more sponging around them, sponge around them, bubble wrapping them from the stresses. And it's the women who kind of plod on and plod on and plod on. So, given plod on meaning, they are taking more responsibility. They have to, live up to the expectations of the family. If a man does not live up to the expectations of the family, oh, you kind of, there is an acceptance. But for women, that is not. They have to live up to that. Otherwise, they face lot of consequences. Taking a very simple example, if you have an alcoholic husband, okay, it's very easily accepted that mard hai wo to peene hi wala hai, there's no point trying to deal with him, let me begin to look after my life and my children, and still try to cater to his needs and get beaten up and stuff. But think about a situation where the woman is alcoholic. Do you think that will happen? That is not going to happen. The acceptance for a woman having substance abuse problem is not there. So she faces a greater, what you can call, greater stressful, it's a greater stressful experience for her. And there are much more hardships that she would have to face. So this social context plays out in a manner that women are more likely to show certain kinds of conditions. Okay. Another thing is also research shows women tend to deal with these, because the context what we are talking is in interpersonal, women tend to deal with these interpersonal difficulties by internalizing it than externalizing it. I tend to feel more guilty. I tend to think that I am not good enough. I tend to think that I'm not a good daughter. I'm not a good sister. I'm not a good mother. Okay. And whereas men are probably growing up in such a manner, or they've grown up in such a manner that it's easy for them to externalize it. कि उसके वजह से ये हुआ है. There is that divide. Meaning, it may be a topic for debate. I'm sure there might be some people who say no, but I personally feel that this divide is there, and that is the reason why women are more likely to show higher prevalence of certain kinds of conditions. Even when we look at substance abuse, if you look at say any of these addictions, women are more likely to become substance addicts compared to men, and that's a biological reality. Meaning, there are some research which does show that our bodies, women's bodies, are made in such a manner that they are more likely to develop dependence, chemical dependence, compared to men. So that biological risk plus the social context definitely sets the ground for a different pattern of prevalence in these psychiatric conditions. And they are less likely to receive help. Meaning, just off the topic, I don't want to take too much of your time with this question, but there was a time, I think, first 5 years of my career in the beginning, I had volunteered for this project as a rapporteur for workshops that were happening for tuberculosis health workers who had to go in. It was a government project, and these health workers were getting trained in that dot system of, how to go into families, tell them, identify if they do have patients, and then send them to the healthcare center, because free medication for tuberculosis was available. So this, I'm talking about a physical condition. Women in the household who may have physical health conditions which are treatable. And what emerged in that workshop with many of the health workers saying is that the families were unwilling to send their women to the health hospital to take medication. अगर हम उसको भेजेंगे तो घर पे काम कौन करेगा, बच्चों को संभालेगा कौन, उसको तो सुबह उठ के, क्योंकि वो टाइम पे जाना होता है, ओपीडी का टाइम जो भी होगा, सो दे वुड से कि अगर वो उस समय जाएगी तो घर में नाश्ता नहीं बनेगा, उसको तो काम पे जाने का है, उसका मर्द को तो. सो व्हेन फॉर अ फिजिकल कंडीशन दिस काइंड ऑफ यू नो
Attitude.
blockage there is, attitude there is, imagine for a mental health. As it is in India, we don't think mental health is a separate thing. It's only now that conversations in the last 5 to 8 years that we are talking about it. So these differences play out because of our biological difference. They play out because of the social circumstances, and they also play out because how health service access is available for women.